afternoon. My name is Dana Kaufman. Today is Tuesday, October 15th, and this podcast is brought to you by LifeSpan Network. And as you can see, we are filming once again on location. Today we are at the Maryland Association of Adult Day Services, and we're pleased to announce that we do have a packed room of Adult Day members who are hearing the latest information on hospital transitions, care coordinations, and updates from the Office of Healthcare Quality. We also want to thank our public policy quarterly sponsor, Omnicare, for allowing us the opportunity to be able to bring you these podcasts on a monthly basis. Now, turning it over to the public policy updates, last week the Department of Health and Mental Hygiene did submit for approval to CMS the redesign of the hospital rate setting system. This redesign does have an impact on post-acute care providers because many of the provisions talk about care coordination and transfers out of hospitals. So while we wait for CMS to approve that redesign, the HSCRC, the Health Services Cost Review Commission, is moving forward, and they have announced the creation of an advisory council. As part of the advisory council, they are also establishing 4 work groups to provide guidance on key concepts of the design. LifeSpan has sent a letter to the HSCRC requesting participation on those work groups. We also want to remind you again that the Maryland Health Benefit Exchange did open up this month, and that employers definitely need to start planning for this process, especially those small employers who employ between 1 and 50 employees. Beginning January 1st, 2014, if those small employers purchase insurance through the Small Business Options Program, you may be eligible for a tax credit, a federal tax credit, to lower your premium costs. So please take a look at that website. A few updates from the Office of Healthcare Quality. As you know, they have been pretty much ramping up their staffing. They just hired Emma Hambright as the Deputy Director for State Programs, and just last week announced that Sandra Brownell from Medicaid would be joining them as their Chief Nurse. Sandra starts October 30th, and we welcome her to OHCQ. As far as the regulations, you probably have already heard, but just to re-emphasize, OHCQ has pretty much come to the final end of the medical adult daycare regulations, and we expect that they would be published within the next few weeks in the Maryland Register. After that is done, probably by the end of the year, we will start working, our OHCQ will start convening work groups on the nursing home regulations, and then assisted living will be taking up last, which probably won't begin until until the springtime of 2014. But we will keep you up to date on the progress being made on those regulatory changes. As far as Medicaid, nursing facilities should have already received your pay for performance scores. Please make sure you take a look at that because there's only a small window for bringing any discrepancies to the department's attention. Nursing facilities should have also received the first telemedicine transmittal, so make sure you have received that as well. Lastly, Medicaid has circulated for informal comment regulations which would combine the older adults waiver and the living at home waiver under one waiver program, which will be called the Community Options Program. The intent is to have this transition start January 1st, 2014. It is part of the state's larger reform of the long-term care services and support, and is also combined with its application to CMS for the Community First Choice waiver, or the Community First waiver. Comments are due back to Medicaid by October 15th. Also due in for comment by October 15th is the draft EMS state plan, which has been circulated by MIMS. If you haven't received that, it can be downloaded on the MIMS website. And that pretty much concludes the public policy updates for October. Thank you for tuning in, and more importantly, thank you for your continued membership into LifeSpan.